My name is Alex Liddle. I'm a Consultant Orthopaedic Surgeon here at St St Elizabeth, and I specialise in hip and knee surgery, particularly partial, primary and revision hip and knee replacement. The vast majority of people who come to see me for hip replacement need it because of osteoarthritis. Other reasons for it can be something called avascular necrosis, which is where the blood supply to the hip can get interrupted, or in a small number of people, either acute trauma like a hip fracture or the consequences of a childhood deformity called congenital dislocation of the hip can necessitate a hip replacement, sometimes at a very young age. So I feel very lucky to be able to do hip replacement because it's just about the best operation in the world. The improvement in people's quality of life is really miraculous. It's really a life-changing operation. Often people with end-stage osteoarthritis of the hip are very restricted. They can't do the things that they want to do, and they really limit their lifestyle. And what happens with hip replacement is almost immediately people feel different. They feel that the hip is freer, they feel that the pain that they had due to the osteoarthritis is gone, sometimes even on day 1 or day 2 post-operatively. I really like operating at St John and St Elizabeth Hospital. I think the nursing staff are very good. I think the patients get very well looked after. I feel very confident in the care that my patients get here. The theatres are fantastic. They've recently been rebuilt. The theatre staff are excellent, and the staff on the wards are very good as well and look after the patients very well. The wards themselves are light and airy and very comfortable. The physios and the OTs are excellent, both as an inpatient and in the outpatients afterwards as patients complete their rehabilitation. And my patients always come back to me and say what a nice stay they've had and how well they've been looked after.